Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome to the Consult Before the Cut. I'm Brittany DeSherry, and today it is me and Taylor.
Oh yeah, Taylor Besh. We are missing Dr. Jonathan Weiler this morning, and we're actually talking about a device today that is his baby. So I know he is having major FOMO not being here, but I hope we do justice.
I'm like, this is something that he loves. And what that is, okay, so we are going to talk today about removing skin without scars. So
that
no
is,
surgery.
can we say that again?
No surgery.
Removing skin without surgery. So, years and years and years in the aesthetic realm and in plastic surgery, if you want to remove skin, then you're having a facelift.
Yeah.
You can do lasers, you can do chemical peels, you can do ultrasound technology to tighten up skin. But if you truly need an excision of skin, that is a surgical procedure until our device that we'll be talking about today, Ellacor, came in, and that was 2021.
Yes.
A device was launched, and Dr. Weiler, before it was even available, he heard about this at a conference, and he's like, guys, this is cutting edge. We have got to get this device. So Ellacor is what we're going to focus on today, and we're going to bring on one of our experts with this machine later on. But before we dive into Ellacor, I just want to talk about the aging face.
Yeah.
Why would you think that would fit into part of your plan?
Well, yeah, because I feel like just like you said, surgery, that's no one else is removing skin. Mm-hmm. No, you're not just removing, no.
Yeah.
For tightening up. And I know Dr. Weiler loves a facelift.
Yes.
Huge fan. But
but that doesn't fit into everybody's life.
That does not, exactly.
Or age,
and
budget, all the things.
Not quite, you may not
quite need it yet.
You're not there yet this may be the step before that.
I saw a patient last week, and it's always refreshing. He saw a 45-year-old girl who was insistent that she needed a facelift, and he did a consultation, and he told her, you do not need a facelift. You need to invest in non-surgical options. And she came to see me after, and she's like, it was so refreshing to see a plastic surgeon and for him to actually tell me he doesn't want to operate on me yet.
No.
And, he's very honest up front, but this would be perfect to kind of bring in for this specific patient. So
I love that. So, okay, let's talk, like you said, skin.
Yes.
Let's talk about the skin.
Aging face.
Just losing it. You're losing all of it.
We lose volume. We lose bone. We lose collagen. We lose elastin, right? So as we age, our skin elasticity, texture, and tone starts to kind of just get a little bit heavier, right?
Once again, guys, this video is going to be amazing.
Dr. Weiler's famous words.
It's just,
your cheeks go to your jowls, your breasts go to your stomach, your butt goes to your thighs. Same thing. The face, everything kind of just starts to settle. So Ellacor is a really amazing device for someone who is having crepiness of their skin, excess jowling, textural changes. They want tightening of the upper lip.
Okay.
All of those things that help in this whole area tighten up. Ellacor is the device.
Okay, so this is for your lower face. We're talking like lower face stuff.
Yeah, so you can use Ellacor here to here.
Okay.
The upper lip is really amazing. Those little vertical lip lines that people despise.
Mm-hmm.
Perfection for the upper lip tightening and lift.
Neck.
Yep. Neck elasticity changes, a little laxity here. Don't look at my neck. I need to talk like this because I need Ellacor.
We're going to do neck lifts on camera for an episode for Taylor and I. Maybe that's what we do. We do Ellacor first on our necks, and then we kind of talk about our neck journey.
So I think the coolest part about Ellacor, so we've talked about this and we'll talk about it again. So when we are younger, there's different layers of skin, right? Mm-hmm. So your epidermal, your outer layer of skin, whenever we're young, is really, really thin. And then that bottom layer below it is the thick layer. Mm-hmm. So that thickens it does this. So the top layer gets thicker and the bottom support layer gets thinner, right?
Yes.
Okay. The goal with procedures to help thicken that bottom support layer is to get in there and thicken it. And how do we do that? Ellacor is really the only device that can go in and basically address that epidermal and dermal layer at the same exact time to cause improvement in both spots. So and I'm kind of jumping ahead, but that is
it seems
the
like
beauty
it's
of it.
Like a controlled injury. That
So whenever you have a scar, whenever you stimulate trauma to an area, whenever you have a cut, fibroblasts attack the area.
Mm-hmm.
Fibroblast, then what? Oh my gosh, she's about to say something. Stimulate collagen and elastin. That causes contraction. So that process is what we want to tighten.
Yeah. Okay. Collagen. Buzzword. Collagen. Everybody wants that collagen. Everybody wants the collagen in their face. Bring me more collagen. Yep. I want all of this. And this is one of these procedures that we can have done to our faces that rush it with collagen to help give us back that little plumpy love, that little plumpy love face.
So the big thing with Ellacor, and the trending thing, it is a skin excision without surgery.
Which is wild to me. As a nurse, that is wild to me. Like taking skin out
So if
without
you've ever had, think of it as if you go to the dermatologist and you have a little area. If you have a little tiny punch biopsy to remove a little tiny piece of tissue to test that, to rule out cancer or something like that. Think of this as a microscopic punch biopsy. So it's 3 little needles, microcord needles, that'll actually go into the skin and remove the skin whenever it comes out. So it is causing micro trauma to the skin to tighten. It is not using any heat, so there's no risk of thermal injury like lasers have and things like that. So before we, go
this
further,
sounds like this sounds like.
I want to talk about the procedure with Kelsey and, her experience with the patients that she is.
Who's candidates for it, all that kind of stuff.
That she's seeing the results from it. So, the technical thing, Ellacor, first and only FDA cleared device that removes skin without surgery, heat, or scarring. Hello, what? That is that life-changing.
Well, that's what I'm saying. I'm because, people will kind of be a little bit nervous. I feel like surgery to people in general, it's very nerve-wracking, especially an elective surgery. I'm just going to go out and do this. And I think this, just the technology that we're coming through, giving patients the options to be able to get somewhat of a surgical result almost without the surgery.
And, being launched in 2021 and such a large jump in technology, they did just launch Ellacor 2.0, I think a couple of months ago. And there has been a few bumps in the road with Ellacor, but this new device is promising and amazing. And I want to talk to Kelsey a little bit about that. We do have the new device at Weiler Plastic Surgery and are using it currently. And we're going to kind of dive a little bit deeper in that and see how it's changing their recovery and stuff.
Oh, okay. This is going to be great too, because also I know when you talk about skin tightening, this can also target some deep wrinkles.
Mm-hmm. Yeah. So that person who has the textural changes and a little bit of sag, that top layer, remember we talked about that top layer getting real thick, the epidermal layer getting thick. That's whenever you get those etched deep little wrinkles over here. And you can't do, you can microneedle, chemical peel, thicken that bottom layer.
We want to get into it.
Yes, you really need to get in and disrupt that area for the stimulation of the collagen and tightening.
See, this sounds
so good.
It's it's one of those things is it too good to be true?
I know.
But no, I have, this is my consult. No, I sleep. Every morning I wake up on the same side of my face, and I wish that I could sleep like a vampire and it would be amazing and I could just do that. But every time, and I've had this deep wrinkle
right there.
I've done the lasers, I've done all that stuff, and it's still just that deep because I go back every night and lay on it. And I'm always I wonder what else we could do.
We cannot Ellacor that close to the eye.
Heartbreaking.
But there's there's things that we can do and stay consistent with it, but Ellacor would not be the perfect option for up
This
there.
is great though, because then you know like who's a candidate, who's not.
Yeah.
Me.
Yep.
I'm not a candidate. But no, we are really going to dive into this
Yes.
with Kelsey B. And she is going to really give us the rundown on who's the candidate, who's good for it. So I say we go ahead, take a break. Let's bring her in. Before we go, I want to thank our sponsors, Rejuvime Medical, the age-defying clinic, where all things hormone replacement therapy, GLP-1 weight loss, peptides, and a little bit of some aesthetic injectables as well. And also Weiler Plastic Surgery Group, the largest plastic surgery group in Louisiana. So hang tight for just a sec. We're going to get our expert in here and dive a little bit deeper into Ellacor.
My name is Felicia Ferranti. I'm from Mandeville, Louisiana, and I had a breast augmentation. For me, I knew that I wanted to go natural. I knew what I was looking for. I remember finding Weiler's website, and I was like, this looks really natural. This is exactly what I'm looking for. Having my clothes fit is a life changer. Seriously, just nothing ever fit my shoulders, nothing ever stayed on me properly. That's all I ever wanted to do was just fill out my clothing, and that in itself, literally a dream come true. I know that sounds dramatic sometimes, but seriously, it is a dream come true.
My name is Parker, and I'm on semaglutide with Rejuvime Medical. My entire life I was an athlete. Stopped doing sports by the time I got to college. You know, the college life just takes a hold of you, and all of a sudden I was not where I used to be. So I started on a really small dose, and within a week I lost 3 pounds. 3 months I was down 30. Kept on doing it because I wanted to see how far I could go, and then I was down 71 within probably 9 months. Choosing Rejuvime was by far the best decision I think I've ever made.
All right, y'all, welcome back. We have with us Kelsey, who is one of the nurse practitioners over at Weiler Plastic Surgery Group. And thank you, Kelsey, for being with us today and talking to us about all this stuff. But tell us a little bit about you.
Okay, well, my name is Kelsey, and I am one of the nurse practitioners with the Weiler Plastic Surgery Group. And I have been working with Dr. Weiler now for 8 years. I first started out with him as a nurse in the operating room, and then I kind of finished schooling and decided to come on as a provider. And I've been doing injectables with him now for about 6 years, and I absolutely love it. This is my dream career. And love
it's
all
the
the
pretty
things.
medicine.
Yes.
It's the pretty medicine that we always talk about. So, okay, but Kel, what's your favorite thing to do as like procedure or whatever for injectable? It could be injectables or procedure.
Oh, there's so many good ones. Obviously, Botox. I think Botox is a game changer for anybody and everybody. I love seeing someone who's never had Botox before and being able to like transform them. But procedures, yes, this is the up and coming favorite, our Ellacor procedure, and that's what we're talking about today. I have been having such great results with it. I have been having patients come back so happy that they actually have a different option now of something that they can do other than surgery out there, and I am a true believer in this. So.
Well, I mean, you've been on both sides of the fence. Yes. You've been in the OR with the facelifts, and now you're, out with this non-surgical option for patients. So I feel like you can kind of, you can give us the full, well-rounded opinion on all this stuff.
Give us a little bit of a technical but understandable, what the heck is, microcoring technology? Yeah. What does that mean to you?
Yes. So microcoring is essentially a device that uses 3 little needles that are hollow, and it goes in and just does basically a punch biopsy of the skin. So it is removing full thickness skin down into the dermal layer of your skin. So it's that deeper layer of skin, and it is taking out little bits of skin in each pass. So we do this a bunch of times on the face, thousands and thousands of times, and then it equates to a larger surface area of skin removal. So you add that up, and each time you do the procedure, you're going to have more and more removal and more tightening of the skin.
And it's not like a chunk of skin. I mean, it is
tiny,
very, very tiny.
Yes.
Aliquot, little tiny pieces of skin, but it does.
Does it look like a little, after you have it done, do you kind of have like a grid?
Yes, so it does leave little holes behind that you can visually see in a grid-like pattern. It's pretty uniform, and we do it in rows and columns, and it, when you're finished with the procedure, you absolutely can see the holes on the skin.
Okay.
Yeah.
So when we talk about Ellacor versus other skin tightening methods, what is the difference between, like we're using lasers and stuff to like tighten up skin and everything, but we're saying this Ellacor is taking it out.
Yes. So it's different than other lasers and microneedling because of the skin removal portion of it. So it is similar in the fact that it is causing microtrauma to the skin, which is still going to stimulate collagen, stimulate elastin, and all those other benefits of those biostimulatory agents. But as an added bonus, it is actually going in and removing the skin. It has a suction device connected to it. So as it cores out the skin, it sucks it up into this canister. And it's really cool at the very end. You can kind of look and see all the skin that's removed.
That's wild. That's absolutely
yes.
wild.
And it uses, unlike radio frequency, there's no heating element. So it is safe. You don't have to worry about the thermal component of different lasers and radio frequency,
And I would add to that, Ellacor is so different because, yes, there's a little associated downtime, but it's the quickest result that you can get non-surgically. Yeah. So if you're doing lasers, microneedling, chemical peels, it is a long, time, injectables. It's a long time to see your final effect. And if you're getting 2 treatments of Ellacor, it's pretty good, pretty quickly, the result of that joweling that's tightened up.
Absolutely. And patients normally see it pretty quickly as well.
Okay, so who's coming in? Who's coming in to you? Who's the candidate for this that's coming into you and saying, hey, Kelsey, I feel like I need something, but I'm too scared to have surgery.
Yeah.
I'm too
so
scared.
the ideal candidate that comes in for this is someone who is not quite ready for a facelift yet. That's somebody, maybe wanting to avoid surgery altogether. It may not fit in their budget, or they're trying to do something else that, they can try before surgery. So ideally, both men and women are candidates, 30s to 60s, who have a little bit of that laxity in their skin, some joweling, deep wrinkles around the mouth. Those perioral lines are really great for this. And just wanting some skin tightening, some skin improvement. They may have tried fillers in the past. They may have tried different lasers or, radio frequency microneedling, and they're just wanting something the next level. So I feel like this is kind of like a bump up in that stepwise approach. So this is, I would say a little bit more advanced, a little bit more invasive than what's out there now. And it's it doesn't necessarily replace the need for fillers or the need for all these things, but it's just another adjunct, great thing in the tool belt.
Okay.
I want to know exactly the specific areas it can treat, because we talked about not lower lids, but where exactly can Ellacor be used?
So right now it's FDA approved for the mid to lower face. So basically the whole cheek, lower face, jawline, around the mouth, or what we call the perioral area, chin, and then into the neck, or the submental area down to the neck. So that's typically what we focus on right now, just because that's what the device was made for. That's what all the...
I feel like that's what... But I mean, like, if
that's
you're
the bread
going to
and butter.
start... like, if you're going to start losing that that fat, that plump and stuff, it's going to be right there. It's going to be all right there, all in that neck region.
Yes.
Okay, but up and coming...
They are coming out with another handpiece that is more designed for the body. So it's going to be a larger handpiece that covers more surface area for, the arms, the top of the knees. People get laxity there.
I think it's going to be utilized so well with like that little teeny tiny excess skin above a C-section scar.
Yes. The abdomen.
The stomach, the lower stomach with that
you
real
don't
fit person.
Do. Yes.
It's going to be huge.
And then there's going to be one for the eyelids as well.
There it is.
Yes.
Yep.
All right,
There you go.
I was going to say, all right, Kelsey, call me. Okay. So I've come in and I am a candidate for Ellacor, and this is what you have suggested. What does this process look like? What does that appointment look like?
Yeah.
I mean, everyone who listens to us, watches us, knows me.
Yeah, take us from the consult to the procedure.
Okay, so definitely consult first, just to make sure that you are a good candidate. Make sure that there's no contraindications. Contraindications mainly are, anybody who has a history of poor wound healing, someone who may have like uncontrolled diabetes or something that's, you don't heal properly or quickly. Anyone who has keloid formations. And then currently it's not approved for darker skin types. That is another thing that they are working on as well. But right now we're just doing Fitzpatrick's 1 through 3. So just kind of making sure that you don't have any active inflammatory issues on the face, any open sores, acne. And then from there, we kind of set a treatment.
Before you go for it, we're talking about Fitzpatrick 1 through 3. So maybe for some others, what does that mean? What is that Fitzpatrick 1 through 3?
So it's definitely more of a lighter skin tone. It's, currently no African Americans or darker, I would say more than what would.
Yeah, I mean, so Fitzpatrick is, 1 through 6. 1 through 3 is the lighter skin tones that I am probably a 3 or 4.
Yes.
You're probably a 3, 2, 3, but less melanin in the skin to cause darker skin type.
Okay.
So not, the higher, very darker brown in the skin. You're not yet, they just haven't studied it enough yet.
To do that.
I think it's coming though.
Yes.
I really do.
For sure.
Okay, sorry, I didn't mean to interrupt.
yeah.
I just wanted to, so everybody can kind of
So then once we decide that, we talk about what your goals are. We talk about how aggressive of a treatment you want, because obviously the more aggressive, more downtime. We talk about, how many treatments you may need. Ideally, everyone's going to need at least 1, but 2 to 3 are recommended.
Okay.
And we space
how far apart? Oh yeah, sorry.
About 8 weeks apart,
Okay.
or until you're completely the skin barrier is fully healed. But we want to make sure you are completely healed before we do your next treatment. But most of the time, about 8 weeks apart.
Okay.
And then from there, we talk about what you may have to do for pre-treating. So depending on if you have any underlying hyperpigmentation, we may put you on a hydroquinone protocol. And
Wait, what's
What's hyperpigmentation and what's hydroquinone?
I like, wait.
So suppressing pigment in the skin. So that way you're not, and because although there is no thermal component to this, we still want to make sure that your skin barrier is as healthy as it can be.
Okay.
We want to make sure that if there is any underlying pigment issues, everything is suppressed and controlled and in the best environment ready for a procedure.
Okay,
Yes,
that's when
a good way to put
Yes.
it.
And that's when this
Quinone would come in. Yes.
comes in.
And then we also like the elastin nectar.
Is that a cream? Hold on. Is that a cream? Is that a cream that you're putting on? So it's a cream that you're putting on the skin to help push that pigment down.
Yes, suppress any pigment.
Got it.
And then the elastin nectar, which is really just helping to build up that skin barrier, get the skin in the best condition, and it's going to help with your recovery time.
Which we've
I
talked
like
about
to say
that before,
nectar is like weeding a flower bed before you do something.
Okay.
So that new seeds can all grow and not have like the junk in the skin in the area. Nectar's amazing. And we do usually start that 2 weeks before for
That's what I'm like. I know we've talked about this nectar before.
Yeah.
For
So most people are going to need about 2 to 4 weeks to prepare for this procedure.
Okay.
Just to get their skin right. And then from there, we...
day of.
Yeah, so we do offer oral sedation if the patient wants it. This is a very comfortable procedure, but some people just do a little bit more nervousness.
Yeah.
They want a little bit extra. So we do offer oral sedation with a little bit of Valium. So if that is the case, they just have somebody drive them the day of the procedure. They take a pill about an hour before they come. They come to the office. And then we get them ready. So the actual procedure itself starts out with numbing. So it's called tumescent numbing, which is a combination of a couple different things. So some lidocaine to numb, some TXA to help control bleeding, and a couple other agents that are basically getting the skin numb, kind of isolating that layer of
That's
skin.
the biggest part.
Right. That we're going to be targeting. And so then we get started.
And then you get to going.
Yes.
How long does the procedure, or I guess it would kind of depend on what areas you're treating, but how long is that taking?
So I would say from like start to finish with the numbing and the procedure itself, you're there for probably about an hour and a half.
Okay.
Pretty quick. So
Yeah, the actual procedure, once you're like prepped and ready, is
Once you're
30
it's just
minutes.
I feel like it's
Yes.
just stamping,
Yes.
going, stamping.
Yep.
Oh.
And then
okay.
the
This is
procedure
great.
itself, it's a handpiece that has the 3 Ellacor needles attached to it. And it is just going in and targeting it. It kind of honestly looks almost like a sewing machine. It's similar to that. Like,
Well, that's fine. Yeah, sew the face like right up to where it needs to
That
be.
sounds scary.
It
but
does
you're
sound
numb.
scary.
It's very comfortable.
It's like, it's really fine. We're going to sew and machine
yeah,
your face.
you are completely
and,
numb. You feel absolutely nothing.
Yeah.
You it's very painless. I have all my patients afterwards tell me, they're like, oh, that was absolutely nothing. I felt nothing. So most of them actually fall asleep during the procedure. So
Okay. Immediately after.
So
what do I have
immediately
to do?
afterwards, you do have the cores. We make sure everything is nice and, bleeding's controlled. And then we put a barrier on your skin. We put the elastinectar on, and then we cover it with an Aquaphor barrier just to, help prevent any type of infection. And then we send you on your way. And then the after care, essentially.
Right.
So no makeup on the face for the first week. So that's, I would say, the hardest for some people.
Yeah.
Let's back up to right after.
Okay.
The new trending thing in the aesthetic world is exosomes.
Yes.
So putting topical exosomes on, or actually plant-derived. There are some placental out there, but plant-derived exosomes being placed on the skin right after is really helping the recovery.
Oh, okay.
And so that is something that's going to be beneficial going forward.
Right after.
Absolutely. And then once they're home, it's just really keeping the face clean with a gentle cleanser,
Right.
No makeup on the face, keeping it moisturized with the Aquaphor, and then just staying out the sun. Normal things to help post-procedural care.
What about, when can I start using, I know you said like moisture with the Aquaphor and everything, but when can I go back to my skin routine?
Once the cores are fully healed. So we do
Okay.
see the patient back at 1 week just to check everything out, make sure everything is closed, make sure that there's no issues at all. And from there, they can resume their normal skin regimen and wearing makeup.
Okay.
And Ellacor, their stance is that you're good to go in 7 days. Give me honest feedback for recovery for your patients.
So yes, everyone I see back at 7 days, the cores are absolutely closed, and there's been no issues whatsoever. So the little grid marks that are left behind, some people, it just depending on how aggressive a treatment we do, how how deep, how many cores we remove, can have a longer recovery time. Typically, most people about 2 to 3 weeks for you to have, your grid marks completely fade away. Some people, couple, 2 months or so. And if it is longer, we do, make sure that we are having you meet with one of our estheticians, seeing what, skin cares.
Can you wear makeup during that time?
Absolutely. So it
you
is
can
easily.
This is something that's camouflaged.
Yes.
Okay.
And it's very light on the skin, very easily camouflaged with makeup.
It's still better than having a scar from a facelift.
Absolutely.
If you're not there yet.
Yeah.
Absolutely.
Wait, okay, so you said cores. Like, how many cores are you taking out when you do these treatments? I'm like,
yeah, so an average up to 10,000 cores.
that is
one
that I
treatment.
just can't. That is, that's so crazy to think like you're just gonna have like 10,000 little rods.
Yeah.
Yes.
That are just going to be in a jar. Like you said, they were sucked out, and
The contraction, though, the healing
Yes.
and the tightening from that is remarkable.
So as your body goes into its natural healing response, the skin, realigns, and those cores, close, and your skin pulls together and tightens. And most people, when I see them back at their 1 week follow-up, they're already like, oh my gosh, I can already see the tightening here. I can already see the improvement in my jowling.
I can't imagine like what that would be. And then like the second one and the third one, it's just like, wow, new face.
Combination treatments.
Oh yeah.
Can you do anything at the same time? Can you do filler the day before, the day of? Kind of give us your spiel on that.
So I would say at the same time, I would not recommend doing anything else, just because of how swollen the face is with the numbing. As far as filler goes, we do not recommend getting filler done within the few months beforehand, only because this is coring all the way down into the dermis. So there is a chance for it to remove any filler in the treatment area, which is not an absolute contraindication.
Yeah.
It just could be that it removes your filler. But once you're, I would say that 1 week post, when your cores are closed and you're able to resume back to your normal skincare makeup, I think it's absolutely fine to resume normal Botox fillers, skincare.
Skin treatments.
Yes.
What's the most common place that you're doing this? Is it like just the entire lower face, the neck, or is it like you said earlier, the upper lip that you were saying?
I would say the most common is the entire face. I don't think I think if you're going to do it and you're going to commit to the downtime, you
Just
treat
do
the
it.
whole face
Get in
to
it.
get the best
Yes.
result. So, there are some people who do want to just spot treat a certain area, and that's totally fine. But I think to get like the best bang for your buck. Just
Tighten it
treat
all.
the whole face. Yeah.
I agree with that, because if you're going to tighten here, this needs to be tightened to take the weight
Yes.
off of here. And the big thing, kind of more so newer thing is a lip lift, which is a surgical procedure. And you remove a little piece of skin right here surgically to pull up the upper lip, because as we age, everything kind of gets
And that's
longer,
what you're talking about, that
softer.
skin underneath your nose. So
And that pulls up. So as our upper lip elongates, that's not a good thing. That shows age.
Yeah.
So plastic surgeons are removing a little bit of skin here to lift up, show more of the lip, shorten the cutaneous lip.
Right.
But once again, that's a scar right here.
It's like right on the nose.
Yes.
Like,
So I think
even if it's
Ellacor is
tiny.
going to become more and more prevalent in this upper lip area, because vertical lip lines, smoker lines, that drives women crazy. So Ellacor here, I think, is going to be utilized more and more in the future for that, rather than a surgical lip lift.
Absolutely.
I love that.
Yes.
I know. Look, I'm all for. I was like, I do know that surgery is scary for a lot of people, and people aren't willing to, will commit to the downtime.
Yeah.
Like we said,
Yeah.
budgetary concerns and stuff like that. So having all of this technology out there that can give you somewhat of the results that you're trying to achieve, I mean, that's amazing.
What
Let's
would you
see.
tell a person who, would you jump to Ellacor first, I guess? So like somebody comes in 40, 45, 50. They're just feeling kind of like, whoa. Would that be like your first recommendation? Or would you do Sculptra,
Right.
filler?
Not necessarily. I guess it just depends on what the underlying cause is. If they've never had anything and they have significant volume loss and what they're needing is just volume, then, I still am a huge advocate for filler, Sculptra. So I wouldn't just jump straight to this. But a lot of these people, they've been doing the fillers, they've been doing the Botox, and they're like, okay, what else? I want to take it to the next level, but I don't want surgery.
Yeah, that's the
so
perfect
I
fit
feel like
for that
that
person.
is what this is really good for.
Yeah. What else?
I'm trying to, okay, so we talked about, is the procedure, I know we said that we numb it and all that kind of stuff, but is the procedure or the post procedure, is there like any painful, is there like a pain management that goes with it? Because you're right on the brink of surgery, and what you're doing is removing, is there any pain associated with it?
Gotcha. Yes, great question. So, no, I would say the numbing, very painless to have done, and afterwards there is no pain. I have patients that sometimes will say that their skin feels like a little itchy when it's healing, but no pain at all. So I even tell them, like, if you need to take some Tylenol, that afternoon, you can. But everyone, when I see them back at their 1 week, they're like, I had zero pain.
That does
love
blow
that.
me away. Nobody complains of discomfort, really.
When you have 10,000 rods removed.
Microscopic. Tiny,
yes,
tiny.
I know, but it's so wild.
Yeah.
Yes.
Yep.
It's like, I guess, for me who I've, different, same but different world that y'all live in, it's just like, oh, wow.
Yeah.
That's so crazy. Just all the little punch biopsies and everything going.
I think coming in and just like having a consultation, the biggest hindrance, in my opinion, to females experiencing this in their 30s and 40s, 50s, is where do I begin?
Yes.
It's all intimidating. It's all overwhelming. It sometimes has a bad rap. It's just coming in for a consultation and just talking.
Right.
You know?
Your skin is different
yes.
than my skin.
Yeah.
So and I think that, just like you said,
Yeah.
the scare, Kelsey had it, Kelsey had it and didn't love it. Well, Kelsey could have completely
Yeah.
different
Right.
skin than you can.
Yeah.
Like, you really need to get in there and talk to someone who can assess the skin appropriately.
Everyone is different. Everyone has different skin types, skin, thicknesses.
Skin needs.
Yes.
Yeah.
So
Everybody
really getting
wants
in there.
Kelsey's skin. That's it. I'm like, everybody wants Kelsey's skin.
Goals.
I mean, but so with Ellacor, like, as we're wrapping this up, what would you say to someone who was on the fence, like, I'm not really sure I want to do this facelift, I don't know, but I definitely need something? What would you tell them?
Yeah, I would say come in for a consult. Let's talk together. Let's look at, different options for you. See what any underlying concerns we can address together, with or without Ellacor, and just get, let's do it. It's such an easy procedure, and it's pretty simple. The science is simple and it works. It's literally removing skin. So there's really nothing to be scared of. I think
It's literally removing skin. It's nothing to be scared of.
That is probably, that's like, please.
But
somebody-
really, it's
Just
a
she's
simple
serious.
concept.
That has to
Yes.
be like the
Simple-
promo
it's a
for
simple
this
concept.
episode. Like, we're just removing your skin. Nothing to be scared of. Come on in. It's going to be good. Trust me, I'm Kelsey.
yes.
So-
Science,
no.
technology is amazing,
amazing.
and it truly is not scary.
Yes, how far we've come, and
Yeah.
the results speak for themselves, and I truly think it's a great option.
Okay, so you said there was Ellacor 2.0 coming. What's Ellacor?
We
2.0?
have it. I mean,
Oh,
it's here.
it's here.
It's here.
I'm sorry.
Yes.
What?
So they just updated the machine and the handpiece to Ellacor 2.0, which is the same thing except for it has a little bit of sharper needles, so it's giving more
Sounds
precise.
scary. That's a
Precision.
good thing.
Yes,
though.
it's a good
Yeah,
thing.
no,
Yeah.
that's
So
that
precision, it's
precision.
giving better coring, more efficient coring. That's given a more uniform pattern. The suction is improved, so it's sucking out more cores. So it's increasing the number of cores that we're able to do.
Yeah.
And all these things are basically going to improve the healing time and the
Yeah.
downtime and
The
recovery
results.
time.
The results.
And the results.
The
yes.
results. I love that. I absolutely love that. Okay.
New and
do we-
improved.
Do we have anything else to touch on this Ellacor before we get out of here?
Invite patients to come, listeners
Yes.
to come and just chat about it with
Yeah.
you.
Or
Happy
wherever you
to
are,
consult.
go see
Yeah.
your person
Yeah.
and have the
Ask.
conversation. All right. Well, Kelsey, thank you so much for joining us today
Thanks,
and
Kel.
kind
Thank
of letting us know about it's like facelift without the facelift.
Yeah.
Yes.
So thank y'all for joining us today. Make sure y'all are following us on all of our social media platforms. You can listen to us on all of
Weiler
the
does.
streaming. I know, like Dr. Weiler.
Follow us below.
Follow us. Click link below. But no, thank y'all for joining us. Always stay curious, always stay informed, and always consult before you cut. We'll see you guys next week.